Allied health professionals, from occupational therapists to physiotherapists, are increasingly supportive of nature-based therapies. But here's the little bit of a paradox. Most patients have never heard of it. Doctors and therapists aren't prescribing it, and clinics aren't offering it. So if the science is strong and the support is growing, why isn't nature therapy mainstream yet in North America? First, let's get clear on what we mean by nature therapy. It's more than just a nice walk in the park. It includes structured practices like forest bathing, therapeutic gardening, animal-assisted therapy, and even green exercise programs. Research shows that these interventions reduce stress, lower blood pressure, boost immune function, improve mood, and even help with chronic conditions like anxiety and depression. In fact, some studies say that just 20 minutes in a forest can lower your cortisol levels as much as some medications. So if it works, why isn't it standard care? Here's the good news. Surveys in 2025 showed that allied health professionals are largely on board. Occupational therapists see the value in using gardens for rehabilitation. Physiotherapists know that green exercise boosts compliance. Psychologists recognize the mental health benefits of forest therapy. In other words, the people working directly with patients believe in it. But belief doesn't always translate into practice, and that's where the barriers are starting to show up. So what's standing in the way? Let's break it down. First is the lack of training. Most medical and allied health programs don't include modules on prescribing nature or leading nature-based interventions. Professionals may want to use it, but they don't feel equipped to do so. Second is that we don't have clinical guidelines. Without official guidelines, clinicians worry about liability. They can prescribe medication with confidence, but how do you bill or measure a prescription for forest bathing? Third, systemic inertia. Healthcare systems move slowly. New practices can take years to be adopted even when the evidence is solid. Fourth is funding and policy gaps. Without reimbursement codes, insurance coverage, or government support, nature therapy often gets sidelined as a nice extra instead of a core intervention. And the result of all of this is a disconnect between what practitioners know is helpful and what actually gets prescribed. The exciting part is that things are beginning to shift. In some countries, doctors are now writing green prescriptions, literally sending patients to parks instead of pharmacies. You can check that video, I think I'll link it above. Community programs are starting to pop up as well. Gardening for rehabilitation, forest bathing for stress recovery, and walking groups as social prescriptions for loneliness. And professional bodies are starting to acknowledge the role of nature in preventative healthcare as well. But until policy, funding, and education all catch up, it's still kind of patchy. Some lucky patients do get access, but unfortunately, most don't. And this matters because healthcare is under a massive strain in North America. Chronic diseases, mental health issues, loneliness, they're all overwhelming our system right now. Nature therapy isn't a magic bullet, but it is low cost, accessible, and backed by research. Ignoring it isn't just a missed opportunity for patients, it's a missed opportunity for healthcare systems trying to cut costs and improve outcomes. Nature therapy is on the cusp of becoming mainstream. The science is strong, the support is there, but until we fix the barriers, training, policy, funding, most patients won't get these incredible benefits. So my question for you is, what will it take to push nature therapy from the margins into the mainstream? Should governments fund it? Should universities teach it? Or should we as patients start demanding it from our doctors? I would love to hear your thoughts and your feelings in the comments. Let's keep this conversation going. Until I see you again, remember I love you. Be excellent to each other. And come, we'll see you in the forest.